Okay, so the next range of motion assessment that I'll be discussing is knee extension. With knee extension, we are assessing extension of the tibiofemoral joint as well as flexion of the iliofemoral joint. So some muscles that we'll be looking at with this range of motion assessment are the hamstring complex, the gastrocnemius, and then it's not a muscle, but the sciatic nerve can also come into play here. So what we're going to have our patient do is lay supine on the table. We're going to have the assessment leg hip flexed at 90 degrees as well as the knee flexed at 90 degrees, and then we're going to place our application head. So we're going to place it laterally, so on the outside of the leg here, right at the knee joint, and then we're going to place the measuring head along the fibula. So we're going to measure here. We're going to place this head along the fibula, the lateral side of the fibula, as well as the short head along the lateral side of the femur. So you can even kind of test if you're actually at 90 with your knee flexed by using this, this 90 degrees number right here. So then we're going to hold this there with one hand, and then we're going to hold this there with one hand. You can even kind of hold it there like this. And then you're going to take your other hand and put it on the base of their foot, so that heel area, and you're going to passively bring them through full knee extension before there's any signs of compensation. Some compensations may include pelvic tilting and pelvic extension. So that's what we're looking for there. And then when you go to measure knee extension, you're going to be looking at this number right here. And that's kind of how you know. And the goal is 20 or less. 20 degrees or less is optimal knee extension. Anything greater than 20, we would look at the muscles that may be preventing full range of motion, which I said earlier, which would include your hip flexors and your quadriceps.